The right to life means the right to health. Health is a basic human right that the Philippine government has vowed duty to respect and promote every human being's right to health, as declared in the 1987 Constitution and stipulated in Article 2, Section 15. The state shall protect and promote the right of health to the people and instill health consciousness among them. Therefore, the state has a duty to provide quality health care and to promote the rights of every man, woman, and child to enjoy a life of health and equal opportunity. To the officials of Lyceum Northwestern University, guests, and all the participants, a blessed health day. Especially to our very own overall chair of the R1 HRDC, Dr. Maria Lourdes Cayotaisa, good day. Our study is about the indigenous peoples of Ilocos on focus, indigenous peoples of Ilocos, Philippines, health-seeking behaviors, healthcare utilization. Yours truly, Dr. Mercita Cuquedeng, together with my co-authors, are very glad to present our research project. The study investigated the interplay of health needs, health-seeking behaviors, and barriers to healthcare access of the Tingians, Kankanaes, and Bagos, the upland municipalities of ICC, of Alilim and Lidlida, Ilocos. A free and prior informed consent was duly secured. 1 year. Took us 1 year to get that. And then we gathered the data. Quantitative and qualitative were obtained using a structured questionnaire. We used the focus group discussion, and the questionnaires are translated to Tingyan and Kankanaey. Even the results are translated. Now, what are the importance of our study? But first, I will try to tell you the objectives. As I've said, there's what we call the interplay of health needs, seeking behaviors, and factors to healthcare access in utilizing available health services. So we describe the socio-demographic characteristics, the health-seeking behaviors, and then the barriers affecting the access, the level of adequacy, utilization, satisfaction of the delivery of healthcare services in terms of course, medical care, maternal and child health, dental program, family planning, nutrition, environmental, health, and sanitation. And the relationship also has been looked into of those variables. Alright, so of course I've said the scope is on the ICC of the indigenous people fully enlisted. And we've talked about with the MOA of the National Commission of Indigenous People Ilocos chapter. So definitely this study is important to the Department of Health for having the baseline data, the LGU, local government unit, we, the healthcare professionals, of course, the target beneficiaries and co-owner of this study, the indigenous peoples of Ilocos, future researchers, please, and of course, all the stakeholders concerned. So we know that the indigenous people are unique and, sad to say, marginalized. There are programs of the government, but there's more that we can give, and this study is the right venue to look into that. As I've said, free and prior informed consent has been duly obtained. In fact, with this study, we are very, very happy and thankful to the team of NCIP of San Fernando and Ilocos, headed by the very able and very cooperative Attorney Marvin Sibiligan. Attorney, thank you so much. Okay, what are the results? Now, in terms of the summary of the health-seeking behaviors, let's just say that the result is neutral. They agreed upon that the supernatural beings use of medicinal plants is still very, very useful. Then in terms of socio-demographic profiles, we can say that the majority of the respondents are or have reached the elementary level only, the basic education with what we call now living below the poverty line. Now, let us take note that this study was not undertaken according to the plans of the researchers, but the so-called in cooperation, and we follow the guidance of the NCIP Ilocosur. Now, what else is very important in relation to our today's prestigious event? Now, in terms of the correlation of the socio-demographic variables, it is so interesting to note that education and the barriers to healthcare access have the so-called significant correlation. So in short, as I've said, they have finished reach only elementary level. We could say that there is that important implication of the knowledge and the education of our respondents. Again, time constraint and financial constraint has also the so-called correlation, significant correlation. So what do we mean? That education is still very important, as well as, of course, the financial constraint. Now, more now that it is the time of pandemic. Okay, so in terms of the program, the most significant is the nutrition program. Now, the medical care, the problem in the indigenous people there is at the time when we went there, when we gathered the data, is the medical care in terms of the lack of the tetanus toxoid. It is because they use that in wound healing, since hunting is one of their primary means of livelihood, occupation. Alright, so let's now go to what we call now summary. I have said most of them generally have reached elementary grades and living below the poverty line. They found it neutral in the services, and nutrition is the most satisfied program of the Department of Health, and education has that significant correlation with all the variables concerned. So therefore, we recommend to have what do we call now a stronger program between the LGU, the Department of Health, as well as that Department of Education to look into these variables. So a program as well as relevant program for the special vulnerable group, the indigenous people, should be designed especially for them. And there should be a cooperation so that we could look into the results of this study and one day for its utilization and implementation. So, ladies and gentlemen, this is the most important thing in terms of health research and education merging together. So we hope that this study will open the eyes that through education still and through health, we can give a better service to our people, especially our special group, the indigenous people of Ilocosur. With this, I would say thank you so much, especially to the NCIP, National Commission of Indigenous People, most specifically to the Region 1 Health Research and Development Consortium for the funding, and we hope to be partners again in the future. Na imbaga bigat, ken nagasat nga panagdingdingig. Thank you so much.